for many reasons, particularly what's called the allostatic load. So that's basically the stressors that women have to go, like Black women in particular, have to go through on an everyday basis. The microaggressions and sometimes macroaggressions that they have to go through just from surviving. So aside from menopause, just being a Black woman in America, having to deal with all of that, that's one of the reasons that you may have an underlying or chronic stress. And we do know that stress can increase your menopausal symptoms. So putting that together, that's why it can be very severe and occur for longer.
Menopause has long been tabooed and shrouded in secrecy, leaving many ashamed and embarrassed about seeking and extending support for this sacred rite of passage. Well, the spirit and mood have changed, and we're surrendering to curiosity, knowledge, and empowerment. In this podcast, I'm sharing my own experiences and point of view, peeking into the lifestyles and rituals of people experiencing menopause, and tapping into experts for their take on the pausal phase. This is for you if you are one of the millions of people in the menopausal phase or want to support them. I'm Dixie Lincoln Nichols, health and well-being educator and founder. This is the Pause Pod. Hey, lovely listeners. Thank you so much for tuning into the Pause Pod. I'm so grateful that you're here. I'm super psyched for my guest today. Dr. Dineasha Potter-McQuilkin is a double board certified physician in gynecology and lifestyle medicine. She's also a certified menopause practitioner and a sexual health specialist. A highly regarded physician, Dr. Potter-McQuilkin transitioned from obstetrics to specialize in comprehensive women's health, focusing on lifestyle management, hormonal care, sexual health, and incontinence management. She's a member of the American College of Obstetrics and Gynecology, the Menopause Society, the American College of Lifestyle Medicine, and the International Society for the Study of Women's Sexual Health. With this, she brings extensive expertise and a holistic approach to support women in achieving their optimal health and well-being. A sought-after speaker, she passionately addresses important topics like perimenopause, menopause, and sexual health. Her approach prioritizes natural, minimally invasive therapies to deliver the best outcomes. Dr. Potter-McQuilkin is dedicated to helping women reach their health and lifestyle goals, serving as a trusted partner in their well-being journey. Dr. Potter, thank you so much for being here. I'm super, super excited to dive into this conversation with you.
Thank you so much for having me. I'm excited to be here. Anytime I can get to talk to you, Dixie, it's great.
I love it. And I love your presence in the space, the knowledge that you possess. I know the listeners would love what they hear. Let's dive in. So you, Dr. Potter, an MD, FACOG, MSP, double board certified GYN and lifestyle medicine, which includes menopause, sexual medicine, and women's wellness. Please tell us what all of that means.
Yes, it's a lot. So I am board certified first in obstetrics and gynecology. So that's what I did my residency in for 4 years, and that's what I practiced for many years. After that, and after delivering babies and doing lots of GYN, women were kind of aging with me and had more complaints, midlife complaints. So complaints about menopausal symptoms, sexual dysfunction, decreased desire, things like that. So because of that, and as you may know, we don't learn a lot about this in medical school and residency. So I had to go back and get additional knowledge. And that's where the MSCP or the Menopause Society Certified Practitioner comes in. So I became certified in that. And I find that during this midlife period, and especially with menopause care, midlife care, it's more holistic. So it's not just about hormones or non-hormones. It's also about lifestyle completely. So in 2022, I also became board certified in lifestyle medicine. So the menopause care goes hand in hand with sexual medicine. So I do a lot with going to ISWISH as well, the International Society for the Study of Women's Sexual Health. And that's where I got information about sexual medicine as well. So that's all of that, and all that I do, basically taking care of midlife women is what I love.
I love it. What events led to your decision to become a doctor and then specialize in obstetrics and gynecology?
Yeah. So to become a doctor specifically, I always wanted to help people. As I got older, became just more women, but I always wanted to help people. And I didn't know what that was going to mean. When I was in high school and even beginning of college, I didn't know if it's going to be social work. My mom is a nurse and she was a practicing nurse for 40 years. So with healthcare, I started volunteering in the hospital, and that's where the hospital, specifically becoming a doctor, became my love. When I was in medical school and we did our rotations, as soon as I went onto the labor and delivery floor, I went to the clinic and took care of women. I said, this is it. This is it. I don't want to do anything else. No other specialty. It's women's health. This is where I have to be. Yeah.
And here you are.
And here I
Okay, so let's get a little specific about menopause. First off,
am.
where are you in your menopause journey?
I'm in perimenopause. I'm perimenopause and I'm feeling all of the things, everything that I tell all my patients, which is why I could come from it from that standpoint as well. And that's literally the first thing that I tell them. I'm definitely, as a doctor, as a menopause specialist, so bringing that information, but just being, perimenopausal, being a mom, helping with aging parents and younger kids, being the sandwich generation, all of that coming from that perspective as well. Yeah.
I love that. And so that leads to my next question, which is how does the training that you received as a menopause specialist help to inform your relationship with your patients now?
Yes, well, certainly, like I said, with the being perimenopausal, that's helpful, but also just knowing more about what that means. So feeling what that means and just knowing more in my specialty and getting educated as well. Because again, I was part of the 80% of the residents who did not feel comfortable taking care of midlife women and a menopause woman during that transition. So going back and getting that extra specialized information, that extra specialized education was very important, knowing that it's not just hot flashes and night sweats, which we were taught, maybe some vaginal dryness. And I knew about the sleeping difficulties, but I did not know about the frozen shoulder, right? So I did not know about the itchy ears and the dry mouth and the skin changes and possibly some eye changes. I didn't know it was, you have estrogen receptors and testosterone receptors all over your body. So a lot of that I didn't know, right? But experiencing that and also learning about that, that helps significantly. Yeah.
That's the perfect combination for really helping women to understand what's happening with their bodies. Being a medical professional and experiencing perimenopause at the same time. So
Yeah.
let's dive into these symptoms. I mean, you mentioned a couple of them, the common ones that we know about. And I have heard some people say they are 33. I know doctors recognize a certain number. And then I've heard people say, no, it's more like 40 some odd symptoms. And then I'm hearing people say, actually, no, it's 100 plus symptoms. So the numbers are all over the place.
All over the place, all over.
All over. Talk to us about the common symptoms and some of the not so common ones, and what women should look out for as they start moving into this process and feeling weird, like some people say things happening to their bodies.
And I think that's actually just what you said. That's probably the number one complaint. I just feel like something's not right, like something's off. So, biologically, we can have the symptoms that we spoke about, the ones that you feel because your hormones are decreasing, your estrogen, your progesterone, and your testosterone are decreasing. So, like I said, the hot flashes, the night sweats, the sleep disorder, you can have anxiety and depression. A common one, especially perimenopausal, might be irregularity of your menstrual cycles, but that may mean that they're closer together. They can be further apart. When they come, you can have what's called flooding, where you're just sitting there and then you just have a gush of blood. Something that, yeah, something that's different than that happened before, right? You may have palpitations or that sensation that your heart is beating out of your chest. You can have skin sensations. You feel like things are crawling all over your skin, vertigo, feeling dizzy. There are, and that's probably something that we don't really associate. So that's one of the more uncommon ones. The dry mouth, feeling like your mouth is on fire, because you even have estrogen receptors in your mucous membranes, right? So the itchy ears with the mucous membranes, vaginal dryness, having a great libido before, but now that completely turns you off. So there are It depends what you read, but yes, anywhere between 30, I would say, and 50 symptoms of menopause and counting, because they're doing more research, which is great. They're doing more research in this area, so I think we're going to find some others as well. Yeah.
I love that you say and counting. So you don't discount some of the symptoms that some people are experiencing. And it may be weird, but not recognized by the greater medical community. Because for me, I recognize some of the ones you spoke about because I've had them: vertigo, the electric shock sensation. I felt things crawling on my skin. I have a cousin who the vertigo was so bad, she would lay on the ground. A doctor told her in the UK, lay on the ground and roll in order to
Yeah.
feel better. So when she was home, I
Yeah.
witnessed this one day. She literally
Yeah.
got down on the ground and rolled, and she said, "Ooh, I feel so much better." Some people suffer from mild symptoms, some people moderate, and then some people very severe. So I feel like this is why it's so important to see a medical professional who specializes in menopause and who can relate to what you're experiencing. Yeah.
And even with all those symptoms that I just spoke about, just like you said, even with hot flashes in and of itself, that can be mild, moderate, severe, right? So with each symptom, you can have varieties of how you feel that, right? So yeah.
Exactly, which adds to this knowing that we are all unique and our menopausal experience is unique to who we are. Which leads me into the next question. What are some of the things that influences or determines what one's menopausal experiences will be like, including their symptoms?
So, one thing that's very important is how we show up at this time, which is why the lifestyle piece of it is very important, right? So, how you enter the transition is very well how the symptoms may progress. So, if you're very healthy at at this point, if you're well nourished or if nutrition's important to you, you're having a well balanced diet, you're exercising daily, stress management as well. Those are very important because it can mitigate a lot of those symptoms. Genetics can play a part. We know that for Black women or women of color, Black women in particular, some of those symptoms can be very, very severe. So genetics also plays a part in it. And then other lifestyle things like smoking. We know that smoking can cause the symptoms to come on or cause menopause to occur earlier, about 2 years earlier. You can have more severe symptoms with that. Alcohol can do that as well. A lot of the complaints you may notice that you don't process alcohol the same way. So before you may have been able to have two drinks and that was okay. Now you can't sleep. It brings on the hot flashes. It's one of the triggers for you. With spicy food as well, you were able to tolerate that before, but now you cannot. So a few of those things, certainly lifestyle and genetic factors, can play a part at this time.
Gotcha. So much going on. And why does that happen? What's happening in the body that causes all of these changes to occur? Like, why the sudden change?
The reason that we become perimenopausal or menopausal is because there's a decrease in the hormones that you're making. So a decrease in particular of estrogen, progesterone, and testosterone. So basically, we're born with all of the eggs that we're going to have. We're born with them. Whereas men, they may be able to make sperm, but we're born with all of the eggs. And by the time that you're in your 40s, you have 1% of those eggs. And because of that, now you're feeling the symptoms. Now you're feeling that reduction. One symptom that I may have not spoken about before was anxiety, and we feel a lot of that because of, yes, biologically and decrease in the brain as well with the neurotransmitters. Then you can have some of that anxiety and feel the fluctuations of the hormones. So what's happening? Why you feel this is because your hormones are decreasing because your ovaries aren't producing the estrogen and progesterone that they were producing before. Yeah.
Got it. Some women understand that their bodies are going through menopause, but they don't understand why that's happening, which is why I feel it's
Yeah.
so important for them to know that there are hormones at work that are decreasing that's causing these changes to happen. And I think one person said it so beautifully a couple years ago. She said, estrogen is a super hormone, right? And
Right.
like you said earlier, we have estrogen receptors on every cell, right? And knowing that we are losing this, it's kind of a scary thought, but I feel like with the support, with the right information, people can move from this place of fear to understanding and then to embracing the entire process. And then, of course, ultimately thriving in it, which is what we want. And which is why you're here to share information and to spread your wealth of knowledge. So there are so many symptoms. There are so many known ones, confirmed ones, questionable ones. Let's talk about managing, navigating, and
Yeah.
managing, I should say, these symptoms. What can women do? What are the options available to them?
So, like you said before, I think that the education is so important. So, when I have patients come to me in their late 30s or 40s, I get very excited because they're coming early and we could really talk about this and kind of prepare them for the journey, right? Education is the number one, knowing what's going on with your body, knowing some symptoms to look out for, letting me know as your provider or your doctor, this is what you're experiencing. So, we can kind of tailor the treatment up to you. That's initially what I like is the education piece first. In terms of specific treatment options, we do have the lifestyle, and we know that stress can increase the symptoms. So stress management becomes a big part of it. Nutrition as well, like we spoke about before, decrease in processed sugars, having lots of fiber, increasing your protein intake because protein is very important to your muscle mass. Proteins help because you have a decrease in testosterone, the muscle mass can decrease as well. So making sure you get enough protein is helpful there. We also have hormonal options because that's really the root cause, right? So the estrogen and progesterone, those are decreased. And so replacing those can be very beneficial and make you feel better. Again, because you have estrogen receptors all over, when you replace that estrogen, it can go all over the body and mitigate a lot of those symptoms. But if someone cannot or does not want to take hormone therapy, we do have non-hormonal pharmacological options too. The two biggest ones are SSRIs, which are selective serotonin reuptake inhibitors. These are antidepressants, so these are what you would use if you have depression, and it can help with anxiety and depression. It can also help with some menopausal symptoms, especially if the anxiety is the number one symptom that you're presenting with. There is also a newer medication. It's a neurokinin 3 receptor antagonist, fezolinetant or Veoza may have been what you've heard. And this one works centrally in the brain where the symptoms can begin. This specifically helps with the hot flashes, but on all of the other the lifestyle modifications can help as well.
Got it. So, in other words, it's not just one thing. It's not
No.
just hormone replacement therapy, regardless of what type it is. And it's not just nutrition and it's not just movement and other lifestyle practices. It's everything together.
Yes, yes. It's definitely everything. And whenever I see women in my office, the first thing that I do is have a conversation about where they are in the journey, what symptoms they're experiencing. And then when we talk about a treatment plan, and the treatment plans we definitely want to tailor to them, we discuss that it's a five-pronged approach. So you can have hormones or non-hormonal options or supplements, but it's also working on the sleep, the nutrition, the exercise, and the stress management. So it's all of them. It's not, like you said, it's not just one. It's all of them, certainly for symptom management, but also so that you can progress through this stage and into your 80s and 90s very, healthy as well.
Right? Because once you're in postmenopause, you're there for the rest of your life.
Yeah, exactly. You're there for the rest of your life. So there's no, I went through it, I'm done with it. No, no, no. No, you're
Exactly.
not. Your symptoms may
You're
get
done
better.
when you're dead.
Exactly, exactly. So we want to be just as healthy, later on as we are now. Sure.
One of the issues I see a lot and problems that women run into is self advocacy and
Right.
not knowing what to do when they come across these, again, weird symptoms, because that's how so many women have explained them. When their bodies begin to change, when these symptoms begin to manifest physically in their bodies and on their bodies, they just don't know what to do. And
Yeah.
so a lot of women stay home, they don't say anything, they suffer in silence because of the shame and the stigmas attached to menopause in the past, and they suffer. What would you suggest that people do when they start experiencing symptoms that they are unfamiliar with? What should be their first course of action?
Just like we spoke about, there are so many options in terms of treatment. You don't have to suffer in silence. I think writing down your symptoms so you know what you're experiencing, because sometimes, especially if you have that cognitive decline or the cognitive fatigue, when you go see your doctor, that it might be difficult to kind of go through all of that. I think knowing that you may need multiple appointments as well, because this isn't something that you really want to bring up at that one annual. This visit is a little bit longer because you can have 2 or 50 of the symptoms, right? And we kind of need to review and address all of them. So reviewing the symptoms, jotting them down so you have something to take with you to your doctor's office when you go. But making the appointments, right? Just starting there, making the appointment and go ahead and speak with your doctor. It can be your primary care doctor, because if they don't know, if they're not a menopause specialist or they have no information about menopause, they can refer you somewhere. Going to societies like the Menopause Society, menopause.org, knowing that you can find a provider who's more specialized in this. If you're speaking to your girlfriends, because they may be going through the same thing, and they may think it's normal, because you're right, a lot of times, especially in certain communities, this is not talked about. There's still a lot of stigma there. We normalize a lot of these symptoms, right? My mom went through it, she didn't do anything, I'll be fine. I can just have some tea, go for a walk, I'll be okay, right? But it might
Exactly.
not be that way. This is a little bit more than that. So just talking to others about it, having that support in the community, going to your doctor. If your doctor is not listening to you, finding a new one, going to the menopause.org, and you can find a provider there who's more specialized in it. So just knowing that you have options, there are things that you can do, I think that's important.
Yeah, thank you for that. It's so important for women to hear that there are things that you should do. Don't stay home and suffer in a silo. Yesterday, I was having a conversation with someone who has a cognitive issue, and she's in her early 40s, and she's experiencing, again, changes that she doesn't understand. And so she wanted to talk to me, and I said, I listened, and I said, listen, I am not a doctor, I'm not a physician. You need to go see a doctor. You need to write down some questions, write
Right.
down what you are experiencing, how you're feeling, and go get your diagnostic tests, whatever they may be. But that first step, I think, for women is so important. Knowing that, yeah, I'm experiencing something, but talking to a
Yeah.
professional so that they can start the process of figuring out what's going on with you. And that
Yeah.
leads to my next question, which is, how can women determine whether they are having actual menopause symptoms as opposed to something else? And I mean, I
Yeah.
already know the answer to this, but yeah.
No, well, sometimes that can be difficult, because you may have like palpitations, for instance. That can be a menopausal symptom, but if you're having severe palpitations with chest pain, that can be something else, right? Even the menstrual irregularities that you may have. Your menses can be, like we said before, they can be closer together, a lot heavier. Can that be a change just with the hormones? Sure. But can that also mean that you may have what's called endometrial hyperplasia, abnormal cells in the uterus? Yes. So finding a gynecologist or finding a menopause specialist who can kind of tease this out, who you can sit with and discuss all of your symptoms, and then knowing when, okay, we may need to order some labs, order some more workup to see what this is, or no, this is kind of just menopause. Let's go ahead and treat and see if you have benefit there.
Gotcha. Because way too many women have symptoms that
Yeah.
may be similar to menopausal symptoms, and they just pass it off as, oh, it's just menopause. Yeah, without
Yes. Yeah.
knowing for sure that it is menopause. Yeah. So thank you for
Yeah.
that.
So if you find, like I said before, if you finding the menopause specialist who can kind of tease this through and see what's going on there. And even a lot of times women will say, okay, you know what, but I don't want hormones, I don't want treatment, why do I have to see a menopause specialist? That's okay. If you don't want the hormones, you don't want any treatment, it's okay. But just knowing what's going on with your body is very important.
Yeah, to make an informed decision, right? You mentioned mental health, cognitive health earlier on. How does menopause impact one's, or can impact one's cognitive health? And what strategies can help manage symptoms like mood swings and anxiety? I know you talked a little bit
Yeah.
about it before, like go into it a little bit more.
Yeah. So, yes, during this time, you can certainly have cognitive fatigue or cognitive decline. You may feel anxiety or depression just because of the fluctuation in the hormones. That may be your first symptom. So, even if you didn't suffer from anxiety or depression before, you might have it now during this menopause transition. Things that you can do, lifestyle. So we know that exercise can help. It can increase those endorphins. So it can help with your mood, getting an adequate night's sleep. Because we all know that if you have a great sleep, then you can feel better the next day. You have less fatigue, right? So your nutrition is very important here as well. Having a well balanced diet, decrease in processed foods because that's not great for your cognition. In addition to that, we know that if hormone therapy, if you desire to have that, if that's started early, that can act like a low dose antidepressant in the perimenopausal period. So that can be helpful as well. Or antidepressants, you may need that, especially if the depression that you're feeling is very severe. Cognitive behavioral therapy at this time can be very helpful as well for your mood and to just to help to navigate this time. So again, I think the take home here and what we've been discussing a lot today is there are options for what you're feeling, right? So you should definitely go seek care if you're having these symptoms, if you feel like just something's not going right, even if you can't put your finger on what's happening. Go and see someone who can just help you go through this, help you tease it through so you can know, okay, this is what's going on. There are options for me, and this is how I'd like to proceed.
I love that. The bottom line is seek care, seek help, talk to someone, talk to a professional so that you can figure out what's going on with your body and make an informed decision. Literally,
Right.
that's it. Yeah.
Yep.
Okay. So,
Yep.
how can women approach menopause management if they have a history of breast cancer or other conditions that might complicate treatment options? Because I know for people who may have breast cancer or had breast cancer before, they may not want to do HRT treatments or hormonal treatments. What are some of the ways in which they can approach their health?
Yeah. So if you have currently have a hormonally sensitive cancer and estrogen sensitive cancer or progesterone, then you may not be a great candidate for hormone therapy. But that's not all the time. Even if you had a history of breast cancer, but it wasn't hormone sensitive, or you had a history of a blood clots, but you may be able to have a different kind of hormone therapy or a different route of hormone therapy. So again, it's important to seek care because even though you think you may not be a candidate, just go and speak with someone because you might. And there also are non hormonal options, like we spoke about before. So if you're suffering, especially if you have moderate to severe hot flashes, that fezolinetant or the neurokinin 3 receptor antagonist, the low dose SSRIs, sometimes there are different supplements that you may want to try. But I think speaking with someone to see where you are, the care should be individualized to your medical history. So going through that is very, very important. So again, I think the take home is find someone that where you can seek care and you can get this knowledge so you can make an informed consent about what you would do like to do now to manage your symptoms and to also go into the future to be the healthiest you can be, certainly.
Got it. Got it. And now here is something else another conversation that has popped up in my communities, and a lot of women have questions around this. What is the appropriate age to start hormonal therapy? If you're in postmenopause, can you start hormonal therapy? If you're like 5 years, 10 years postmenopause, can you start hormonal therapy? Is it effective? Yeah, talk to us about that a bit.
Yeah, so studies show that there's something called the timing hypothesis. So that's when you would get the most benefit. So we do know that hormone therapy can decrease your risk of diabetes. It can decrease your risk of heart disease by almost 50%. So there is a time where you would get the most benefit. And that's within 10 years of menopause. So 10 years of that last menstrual period when you're actually menopause. And menopause is 12 months after that last menstrual period. It's really a retrospective diagnosis because you may not know that the period you're having is your last, right? So it's 12 months or a year after that. So within 10 years of that menopause and age less than 60, that's when you get the most benefit for it. But can you start outside of that? Yes, you might be able to. That's when it becomes more nuanced, and it should be, again, individualized. But the best time is within those 10 years, age less than 60, but you may be able to start outside of that.
Okay, so you mentioned something really important there that we should have covered earlier on, but no time like the present.
Yeah.
Let's talk a little bit about perimenopause, menopause, and postmenopause. Like, when is the actual time that people start perimenopause? When does menopause happen? And what is postmenopause and when does that happen? Yeah, share a little bit about that for us because it's so confusing to some people and clarity is so important.
Right. Yeah. No, I agree. It is very confusing. And I think for years, all we heard about was menopause. And I think the menopause word kind of encompassed it all. But yes, there's perimenopause or the menopause transition, then menopause and postmenopause. So the average age of menopause in in this country is about 51, or in the US, about 51 and a half. But we know that the menopause transition or even symptoms can start before that. The transition or the symptomatic period can be about 4 to 7 years before. For some ethnic groups, it can be even 10 to 14 years before that, or you can be symptomatic that long. But like we said before, the menopause is that 12 months after that final menstrual period, and it's really just one day, right? So when you're at that 12th month, after that final menstrual period, then you're menopausal, and then after that is postmenopause. And like we said, you're postmenopausal until you die, right? So
Right.
it's perimenopause or the menopause transition, menopause, and then postmenopause.
Got it. I know one of the things that women go is like, wait a minute, I'm in menopause for one day? One day?
Yeah, yeah.
And then
You know, because we use it all together, and I say that's okay. It's okay if you don't know the terminology. It's fine. Come to see me
right.
anyway, and let's talk about where you are.
Exactly, exactly. By the end, they'll understand and they'll get it, right?
Yeah, yeah,
Okay, all right. So we cleared that up. Let's talk a little bit about Black women and their menopause experience because I think it's so important. We know as people who are in this space that there
yeah,
are disparities, there are systemic disparities that causes Black women to experience menopause very differently than their white counterparts. Talk to us a little bit about that. And there is the SWAN study that went in a little deep. What can you tell us about that experience? And what are
yeah.
some outcomes that you would like to see happen to change those numbers that we're hearing from the SWAN study?
Yeah, yeah. So, so that SWAN study was very important. That's the study of women across the nation, and with that, that's where we found out the different disparities or between different ethnic groups, how you may experience and go through the menopausal transition, and how your symptoms can be different. In that study, we found that women of color can experience symptoms for longer, more severe, and they may even start earlier than their white counterparts. For Black women specifically, menopause symptoms can start about 1 to 2 years earlier. They can experience it for that 10 years, and the symptoms are very, or can be very severe. Also, for many reasons, particularly what's called the allostatic load. So that's basically the stressors that women have to go, like Black women in particular, have to go through on an everyday basis. The microaggressions and sometimes macroaggressions that they have to go through just from surviving. So aside from menopause, just being a Black woman in America, having to deal with all of that, that's one of the reasons that you may have an underlying or chronic stress, and we do know that stress can increase your menopausal symptoms. So, putting that together, that's why it can be very severe and occur for longer. We know, again, the way that you show up. So, in the Black communities, chronic hypertension, diabetes is more prevalent. And so when you're entering the menopause transition with these chronic diseases, that can make your experience more severe and can last longer as well. What we spoke about before, where we don't seek care sometimes because of things that may have happened when you tried to seek care before, and biases, systematic racism and biases, and sometimes in the medical community. I think that the under underrepresentation of Black doctors. So Black doctors make up about 5% of all doctors, and Black female doctors make up about 2%, right? So the underrepresentation there, when you seek care, might kind of deter some women from seeking care, and because of that, they may experience the symptoms that can affect their life. What I would like to see. I would like to see more representation. That would be great, or more communities such as this where they can get some information, and just kind of cultural competency, because I think it's difficult, to, at least in the short term, to believe that there'll be more representation in the healthcare space, but teaching other doctors that when patients come to you, you should have some cultural competency, know what they're going through, know about that allostatic load, and know about the chronic stressors that are going on.
Ah, this is so good. So, so good because it's so real, right?
Yeah,
And it needs to be addressed. And so I want you to talk to Black women. Like, I know Black women are listening to this podcast. And so
yeah.
Dr. Potter is going to talk to you. What should Black women do to arm themselves so that they can have healthy, thriving, vibrant lives?
Right. So I think, first and foremost, we want to have a healthy lifestyle, right? We want to decrease the risk of the chronic diseases, decrease the risk of the diabetes in our communities and the chronic hypertension. We can go with our girlfriends. Let's go for a walk, right? If we decide, I too love to have a nice big Thanksgiving meal, and that's how we get together is through meals, but let's make sure that they're healthy and they're whole food, plant based. Very, very important. So to decrease that, when you seek care and in the healthcare community, one way, advocate for yourself, right? Like we said before, write down your symptoms. And so take that to your doctor. If you feel like you're not heard, find someone who's going to spend that time with you. Going to, again, communities like this, and you can ask a friend, where did they go? Did they have a great experience? And that might be some place for you to try, right? Unfortunately, yes, this is where we are, and we have to kind of do these different things. Um, if you can, it's be nice to seek a doctor out where, someone who looks like you may have a little bit more experience or understand, right, what's going on a daily basis. So I think that's helpful, if that's available to you.
Thank you for that. Because we have to be proactive. The
Right,
systems are not going to change immediately, not in the short
right.
term, like you said. The system is a marathon system. And so
Yeah,
we have to put things in place that will serve our needs right here and right now, and leaning into the community that's there, leaning into information like yours, seeking out, finding other doctors of color who has a perspective from where you will understand is important also, and supporting those doctors and those experts. And also, like you said, yes, it is so important for the broader community to be on board and to be
yeah,
sensitive. Like you said, cultural sensitivity, it's absolutely integral for Black women to have the kind of experience that they deserve during this menopausal journey. Because, like you said, the disparities are so wide and affects every aspect of their health and their lives. So,
yeah,
yeah, we've got work to do, but thanks to you, work is getting done. And we have
yeah,
things like A Life in the Pause and Wise Pause and all of these amazing organizations that are founded and centered by Black people who are seeing other Black women experiencing these issues and
yes,
supporting them in the best way that we possibly can. Yeah. I want to come back to you
yeah.
and what you do because you are in the perimenopausal transition. I don't know how long that's going to last for you, but I hope it's not too long.
Me too.
You're in the throes of it. And
Yeah,
you too have to take care of yourself. And as an expert and a professional, you are constantly interacting with other energies of other people who are going through similar things like you are.
yeah,
Tell us what you do. Share 3 self-care practices that keeps you grounded and rooted so that you can take care of not just yourself, but your community and the
yeah.
people that you support.
Yes, well, I have to be the healthiest to take care of my family and certainly my patients and all the women that I love to take care of. So, nutrition is number one because what you put in your body, you get out. So, for me, I like to focus in terms of nutrition. I focus on three things, and that would be the fiber intake, protein because that's very important. That's the building block, important for your muscles. I want to be able to like stand up quickly to be able to walk around, do all the things at 80s and when I'm in my 80s and 90s, right? So very important. And then processed sugars. I don't like to have. I too like to have a nice, snack once now and again, but I don't like to have a lot of processed sugars in my diet because I feel more sluggish and I can't move as well, and all of that. So that's in terms of nutrition. That's what I like to do on a daily basis. Personally, I do a lot in a shake and kind of on my way out in the morning. I'll add my protein and any additional fiber, although it's best to get it in your diet. But if you're finding that you're lacking, adding it in a shake in the morning, I think is a great way to go about it. I also like at least once or twice a day to kind of just center myself, sitting still. If I can do a meditation, then I will. But even if I don't have time, just kind of sitting still and have a sense of clarity and focus, especially on the busier days when I'm running around the office. I have to leave, run home, take my son to soccer, and do all of the things. That's really sometimes it's difficult to kind of get a chance, to kind of sit and focus. But at least twice during the day, I think that really centers me. So I try to do that. And movement, daily movement is very important. If you're unable to get that exercise or the 150, of moderate intensity exercise weekly that I recommend, even moving around, having a goal of 10,000 steps important, but even without that, just moving around and staying active, very important. If you can get out into nature, also very important. I say sunlight before screen light. So if you can get that first thing in the morning, that will help with you sleeping at night. That will help with your mood and all of that. And also practice what's called grounding. If you can go outside, if you can lay in the grass, that's great. If you can't, just kind of walking in the grass, just feeling that energy, very important. So some version of this I try to do every day. If I can't, at least I know I go for like a hike at least once a week. I try to get out there. I just feel more centered and prepared for my week to prepare to show up for my family and my patients, and I just feel better overall.
I love it. I love it. You're in action. And the thing is that you have to take care of yourself if you
Right.
want to seriously take care of other people because you
Yeah.
cannot operate or work from a cup that is empty, right? We know
Yep.
that it has
Yep.
to be full and overflowing in order for you to do the work that you have to do and be there for the people that you have to be there for. I love the grounding, being barefooted on the ground, in the grass. I have a grounding mat as well that I purchased. So in the winter, because
Yes.
I don't want to be outside with my feet on the ground. I put it on the floor, I plug it in, and I rest my feet on it, and I ground that way. So there's so many
That's so great.
options.
That's so great. Yes.
Yeah, yeah, there's so many options. Thanks for sharing those with us. Now, I have for you a hypothetical question. It's
Yes.
hypothetical, so there is no right or wrong answer. Just shoot away.
Go
And I
ahead.
asked a variation of it. It's a if, what, why question. So,
Mhm.
what if you were able to predict the onset of menopause with advanced genetic testing? How would you use this information to support women, and why might personalized menopause care be beneficial?
Oh, that would be great. If I could predict that, that would be excellent, certainly. Because again, the way that we show up is the way that we can progress through it. So knowing when it's going to come, knowing when, okay, it might be a great time for me to start hormone therapy now because my symptoms may not get to that severe part where it can affect my life. Right. So just knowing, being prepared, educating ourselves, knowing, okay, this is going to be the time. If I kind of slacked off before, I'm not ready to start hormone therapy. I'm not ready to adjust my lifestyle. No, tomorrow menopause is going to start. So here it is. You got to start today. So just knowing that is very, very important. So I think that and creating that specialized care. If I know that menopause will start now for you, this is how severe your symptoms will be. These are the symptoms that will happen. I'll know how to individualize your care. And menopause care should be individualized. Everyone's experience is very unique. Your journey is unique, so the care should be unique to you.
I love that. And do you think that knowing, you can actually do something to offset even? right? Like if you knew when it was going to come on.
Yes, so you may be able to do something. We know that the hormones will decrease, so you may not be
Right,
able to have, go through it with no symptoms. But again,
right,
the way
right.
that we show up, right? So the way that we show up at this time can mitigate the symptoms. So being prepared that way, I think, will help if we know. Yeah.
Got it. Got it. I love that. Dr. Potter, you are a wealth of knowledge, information, compassion, and the way you approach menopause with such care, which is evident because of the self care that you give to yourself. I absolutely appreciate. I have to have you come back so that we can talk more about menopause, but different aspects of menopause, like the research around menopause. What's on the horizon for menopause? What's on the horizon for treatments? What's on the horizon for funding and all of the things that we need in order to move through this space as healthily and vibrantly and successfully as we should, because we've not been given the opportunity in the past to really show up as authentically as we can during this phase, because we've just been shoved aside, our needs have been shoved aside, and none of our needs have been met with excitement or enthusiasm, to say the least, right? But
Yeah.
there's a
Yeah.
renaissance happening now, and
Yeah.
voices are
Yeah.
rising, momentum is building, and we just hope that that stays and holds the course. So I'd love to have you back. Thank you so much for being here and sharing with us. Are there any parting words that you'd like to leave our audience with?
Yes, I think, like we said earlier, education is key. You do not have to suffer in silence. I think definitely seek the care, advocate for yourself. There are options out there for you. And Dixie, thanks so much for having me. Yes, I definitely want to come back. Menopause is having a moment, so we'll have so much to talk about, all the new research, all the things that are coming down the pike. We can definitely have more conversations to come. Yeah.
Thank you again, Dr. Potter, for your wealth of knowledge. I appreciate you. Dear listeners, thank you so much for leaning in and listening. Let's continue to perimenopause and prosper. I'll see you next time.